So the UK NHS recommendations currently for adults with type 2 diabetes are that if they're on insulin therapy, they should routinely monitor their blood glucose. There is no specific frequency that's mentioned there, but there currently is reimbursement for a device known as the Freestyle Libre glucose monitoring system, which allows individuals with type 2 diabetes as well as type 1 diabetes to monitor their glucose frequently without having to use routine finger sticks. So the Freestyle Libre system involves a technology called flash glucose monitoring, and this involves two components, a sensor and a reader or a smartphone. Either one can be used as a second component. And what happens is the sensor is placed on the back of the arm for up to a period of 14 days and can be used to obtain glucose readings with a swipe of the reader or phone over the sensor in just 1 second. And this provides the current reading as well as the 8-hour history as well as a trend arrow that can help provide direction toward future trends. In terms of clinical benefits, we do have clinical trials that have been published that show that individuals with both type 1 and type 2 diabetes are able to reduce the amount of time they spend in hypoglycemia, which could be potentially dangerously low glucose levels. And that they are also able, in the case of type 2 diabetes, to reduce their hemoglobin A1C if they are within certain groups, such as those under 65 years of age. And this is very important because that hemoglobin A1C level is what is often used as an indicator of the potential risk for complications related to diabetes. In terms of economic benefits, we have demonstrated in some recently published manuscripts that for individuals who are monitoring their glucose 8 times or more per day, that in fact the Freestyle Libre flash glucose monitoring system is certainly cost effective. And we also have data that for individuals who monitor less frequently than that, that there is also a positive economic impact from use of this technology in terms of decreased resource utilization, which also makes it cost effective for those individuals.